So hi all, welcome to our Antioch Homeless Coalition meeting, January 28th, 22. Oh my God, this month it flew by so fast. Welcome, and we have, me, Nicole Gardner with Facing Homelessness. Lacey is here with JAR. We have Mariah with This Active Art. And Lacey, can we go ahead and just get started?
Yes. Hello, everyone. Sorry, I'm having some technical difficulties and my camera is not working today for some reason. But we do have a guest who was kind enough to hop on our meeting today, Danielle, with the BAART program. And she has actually prepared a PowerPoint presentation for some information to kind of tell us about the program and what they do. And I'm really excited to hear about it.
Well, thank you for having me. I really appreciate it. So again, my name is Danielle. I am a patient navigator for BAART. By BAART, sometimes people get confused. They think we're Bay Area Rapid Transit. We are not. We are Bay Area Addiction and Research Treatment. And we primarily focus on helping individuals who are suffering from opioid use disorder. We have some other services too that I can go into a little bit more when during my presentation. But I wanted to let you guys know that we are located in Antioch. We are on Sunset Lane, and we are across the street from Rayleigh's in Antioch. So just to kind of give you an idea of where we are, we're next door to 7-Eleven. And then I do have a presentation that I would be more than happy to share. I got it right here. All right. Oh, it says it's disabled for me to share.
Okay, let me see, because I thought that. Let's see. Can you try now?
Yeah. Oh, there we go. Cool.
Okay.
And then bear with me, my computer is incredibly slow. But hopefully you guys can at least see it on the screen right now. Okay, great. So this presentation is a little bit more technical than some of the other ones that I do. I figured that would be better for this kind of format because I think a lot of you guys are already pretty much aware of opioid abuse, how it affects certain populations more than others, and how MAT can help, what medication assisted treatment is. So I just kind of wanted to go more in depth with it in general, because I'm pretty sure most folks already have a general idea. So I wanted to get a little bit more nitty gritty with it. So again, if there's any questions or concerns, feel free to ask either at the end, or if there's something that's kind of concerning, you can ask while I'm going through it. So medication assisted treatment at BAART primarily is the the treatment of addiction to opioids such as heroin or other prescription pain relievers. Fentanyl is another big one that we see often. The prescribed medication that we use to treat this disorder is FDA approved, and it helps normalize brain chemistry, block the euphoric effects of opioids, relieves physiological cravings, and normalizes body functions without the negative and euphoric effects of the substance being used. At our clinic, we provide methadone and buprenorphine maintenance. We also include individual substance abuse counseling, coordinated pregnancy treatment. This is important, case management, education on addiction in general, overdose and relapse prevention. This is particularly important now with this fentanyl epidemic that we're seeing. A lot of folks don't realize how potent it is and how prevalent it is. And so our counselors are working aggressively to try and educate our patients on the dangers of overdosing with fentanyl, particularly. We have wraparound services to other community resources. And when patients are ready to move on from our program, we do provide support for that. And we also do guest medication services. So if you are a patient at another program and you need medication, you're not one of our patients, but you are enrolled in a MAP program with another clinic, we can provide you medication if that clinic okays it. So that can be helpful when someone is out of town or they're displaced. A current example that we've been dealing with is with the pandemic, the COVID pandemic. People are having to quarantine, and when they're homeless, they're being put up at the only hotel that I know of is here in Richmond. And we have a clinic out there. And when folks are receiving their medication, let's say from a CONTRA location that's not affiliated with us, our Richmond clinic can still assist with getting them the medications while they are in quarantine at that hotel. So that's just one example of how our guest medication services can be helpful. So medication assisted treatment at BAART, we utilize medications in combination with counseling and behavioral therapies. We do this to provide a whole patient approach to the treatment of opioid use disorder. Medications used in MAT are approved by the FDA. MAT programs are clinically driven and tailored to meet each patient's unique needs. This is also research-based and evidence-based treatment. It is one of the most effective treatment options for individuals who are suffering from opioid use disorder. So one of the benefits is it reduces withdrawal symptoms and controls cravings, minimizes potential for relapse. If you're not suffering from severe withdrawals, you're less likely to go out and participate in illicit activities that will get you to want to get rid of those horrible feelings. It stabilizes patients in early recovery. Sometimes having to have the responsibility of showing up every day can kind of give you that sense of purpose and structure that some folks need. It allows patients to maintain their commitments and relationships. Unlike residential treatment programs, you don't check in and not check out for a while. This allows people who may have a job and they don't want to lose that job, they can still receive treatment from us and still maintain their commitments to their occupation. It reduces disease exposure and other health risk factors. It decreases, like I said earlier, patients' involvement in dangerous or illicit activities. If someone wants to get their fix and they don't have the means to pay for it, they're going to participate in behaviors that are not safe for themselves or others. Having a place like BAART where they can receive medication to deal with that rather than or receive treatment for that rather than going out and participating in those kind of behaviors is obviously a better form of harm reduction. And when these are used properly, which can be difficult to determine initially, I will admit, but when it is the correct dose is achieved through a medical provider and the patient's feedback, they should not create a high or any kind of euphoria that you would get from a normal opiate. So it's important that our patients do communicate with our provider or counselor. If they're more comfortable talking about their counselor, that's fine too, about how the medication is affecting them. So methadone is one of the more popular options and medications that we provide at our clinic. Methadone is similar to other full agonist opioids such as hydrocodone, morphine, or even fentanyl. The critical difference that makes it effective in treatment for opioid use is that methadone is a long-acting opioid. It is active in the body for about 24 to 36 hours, meaning that one therapeutic dose of this medication will last a full day. Whereas other opiates have those peaks and valleys, this just kind of steady. So the risk of abuse and that euphoria that people are seeking is not going to happen. This medication was the first approved for the treatment of opioid use disorder. It's been approved by the FDA since 1972. It has a longer history. They found that it's better for people who've had a pretty extensive, severe history with opioid use disorder. So if they've been taking like high quantities or if they've been using fentanyl, which is very potent, they found that methadone is a more effective treatment versus buprenorphine, which we'll talk about in a second. Each dose, whether it be methadone or buprenorphine, is unique to each patient, as I mentioned prior. And our methadone is, well, I believe this is true for most cases, for most clinics. It's dispensed primarily as a liquid, It looks kind of like a deep pink color. And this is done so that it's difficult to divert to the public. They're required to drink the medication and then they can take off. Buprenorphine is similar, but there are some things that make it a little different than methadone. Buprenorphine has a ceiling effect. That means at a certain point, increasing the dose isn't going to make the medication any more effective. Also, when it is combined with naloxone, which is under the brand name Suboxone, it prevents the abuse of it. So if someone was to take this medication outside of our clinic and try to get high on it by trying to snort it or inject it, it would put the patient immediately into withdrawal because the naloxone would be activated as well. This option is great because it prevents overdose. So some folks prefer this method versus the methadone because of just that safety net that it has. So if a patient was prone to relapse often and they were concerned that they weren't going to be able to stick to their treatment program that they have with their counselor and our provider, then Suboxone might be a good option for them, because if they go out and relapse and take heroin and that's laced with fentanyl, the naloxone would prevent them from ODing. So that's one of the better side effects of this particular medication. It's not as well studied. It doesn't have a long history as methadone does. It's only been approved since 2002, but that doesn't make it any less safe of a drug. It just isn't as, it hasn't been studied as long. Still a very good medication. In fact, this medication, the state of California is more lenient on. They'll allow folks to take this home sooner than methadone. So counseling is an important part of our program. It is research-based that if a patient participates in a counseling component in their MAT program, they are more likely to succeed in their recovery versus a MAT program where it's just medication alone. So at BAART, we are extremely strict on this. If a patient refuses to participate in the counseling part of our comprehensive program, they cannot receive treatment from BAART. We've had patients come in asking just for medication. Unfortunately, we are unable to do that. They need to participate in our counseling. If they do not, then we would be unable to continue providing treatment. It's very important. And some of the benefits, which I'm sure most of you guys are already aware, is it helps kind of change your thoughts and feelings and behaviors towards opioids. It helps folks develop learning better new coping mechanisms. So when something horrible happens, your gut instinct isn't, I gotta go get high. It's, okay, how can I work through these feelings? Who can I talk to, rather than how can I escape it and not deal with it? We also try to foster a safe and trusting environment to discuss these topics. It's not always easy to talk about some of the stuff that's gone on during one's active addiction. And so we try to create a place where folks can talk about their past and how to move on from it and create a better future for themselves. And this includes working on healing and rebuilding relationships, and it helps develop better skills to handle those triggers and prevent relapse. The stronger our sense of community, the more likely we are to succeed in our recovery. So MAT effectiveness, it has been proven to improve patient survival. This is because by reducing the physical withdrawal symptoms, which have been reported by patients that you feel like you're going to die, it's like the flu times like 100. You're going to increase retention in treatment because you're not fighting those physical withdrawals. It also allows you to focus on the psychological portion of the addiction versus just thinking about how horrible and sick you feel all the time and obsessing about the drug. It allows you to kind of think about healing mentally and emotionally rather than just physically. As a result, since we're not drug seeking, we're not going to participate in illicit opiate use, and we're not going to participate in criminal activity that can get ourselves in trouble and others. It increases a patient's ability to gain and maintain their employment. This is important. I know some of our patients who have fallen to becoming homeless is usually because after a while their addiction, they start putting it as a #1 priority and they lose their jobs, they lose their family support, they lose everything and they end up on the streets. We work to help patients through their recovery also gain employment. We do this by working with Rubicon, and there's another program which my mind has left me. Factory OS is another program that we're now currently working with, where they will hire our patients specifically, as long as they're working their program. So that's an important aspect. Also, it improves birth outcomes among women who have substance use disorders and are pregnant. This is also very important. Some people feel that cold turkey is the best. Might work for some people, but if you are pregnant, it is not a good idea. Medication-assisted treatment in pregnancy. Most doctors will advise women to not abruptly stop the use of all opiates because it can cause risk of miscarriage, premature labor. It'll cause the uterine walls to contract because of the withdrawals, and it can cause a miscarriage. So by taking the medications, you're creating a safer environment for the development of a healthy baby. And you do this by reducing withdrawal symptoms. Also, another side effect of this is mom is not going out and again engaging in illicit behaviors. She's not going to be drug seeking and doing whatever it takes to get it, whether that be promiscuous sex, use of needles, engaging in dangerous violent crimes to get resources, to get drugs. So it's better for moms to stay on a medication-assisted treatment program versus continuing to use illicit drug use or to completely stop altogether. At BAART, we do this in close conjunction with the patient's OBGYN. If they do not have an OBGYN, which does happen occasionally, we have partnered with La Clinica, and they have agreed that if a pregnant patient comes in need of an OBGYN and they do not have one, they've guaranteed within 2 weeks they will provide that patient with a prenatal appointment and a provider to help them through their pregnancy. I think that's awesome. Prior, we were not allowed to allow a patient to start our program unless they had already had a OBGYN. And now we can do that even if they don't, because La Clinica has been able to step up and provide that necessary medical service. I have reached out to Planned Parenthood too here in Antioch, but they haven't been able to provide a direct promise that they would be able to do that like La Clinica has. So I'm very appreciative of that program. We also provide primary care. This is not something that has anything to do with MAT. It's just something else that we do for our patients. They don't have to participate in our primary care program, but if they do, they are welcome to, and they can see our physician up to 4 times a year. So intake and admission, what to expect. Unfortunately, we don't treat adolescents. We only treat folks that are 18 years and older. You do have to have photo ID. Now, this is a problem with the homeless community and those that are undocumented. We are able to work around it because we take our own photo ID in the clinic, but it's not enough per DEA regulations. So what we try to do is we will work with the patient to obtain the proper identification that they need so that they can continue the program. We do this for 2 reasons. One, we legally have to. And the other reason is even if we didn't, we still feel it's an important process of recovery. So when a patient starts to get their life back on track and they're getting more stable in recovery, when they start to go look for those jobs, when they want to open up a bank account, when they want to purchase a car, they're going to need that identification. And so we try to help remove that roadblock while they work through the recovery so that they can be successful. Technically, we have 30 days to get the patient to have some kind of form of proper identification, but so far we haven't kicked anyone out who hasn't done that. We try to work with them. We understand that, sometimes it can be difficult given their circumstances. We also only treat opioid use disorder. So if a patient's primary drug of choice is a stimulant like methamphetamine, we don't provide treatment for that. The drug of choice has to be opiates. So if they are a polysubstance abuser, but their primary choice of drug is heroin, then we can treat that. We're not going to say, oh no, you also have a problem with meth, so we're not going to help you. It's not like that. It's just we treat opioid use disorder. So that's the only addiction that we treat. If there seems to be a problem with like alcoholism or stimulant abuse or something like that, we do have wraparound services we can refer out, but we primarily only treat opioid use disorder. Also, it's important that our patients agree to our rules and regulations and policies and procedures. One I mentioned prior was our counseling portion of our program. If a patient refuses to participate in that, then we can't provide treatment. Also, we expect our patients to be respectful to staff and other patients and all that good stuff. So if they were unable to do that, then we wouldn't be able to continue treatment. So what would someone expect at intake? There will be a complete review of medical and drug history. We do this again to establish that there is an opioid use dependency. We do this through a physical assessment, a drug screen, and a consultation with our intake counselor and our medical provider. We'll also review our program policies and procedures so that the patient is aware of what they're getting themselves into. We don't just thrust it on them after they've already started the program. If you want to, you can reach out to me for expedited enrollment. I have my phone number here and my email address. I'm available mostly from 6 a.m. to 2 p.m. And I can make a certified counselor available to meet or to speak with someone. I know that this isn't always an option. People don't tend to like appointments, but it is, I recommend it. You won't have to wait as long. You'll get treatment faster, but it isn't required. We do accept walk-ins. So walk-ins are welcome between 6 a.m. and 12 p.m. If you arrive after 12 p.m., it's hard for us to begin the intake process because it takes about an hour. And we want to make sure that once you start, you dose before you leave. If you do want to walk in, please come in as soon as we open at 6 a.m. It will reduce your wait time. On average, it is about an hour. The earlier you get though, the quicker we can, reduce that. We do triaging as well. So if a patient comes in and they're like vomiting in our lobby because the withdrawals are so bad, we're obviously going to see that patient first. So do expect that maybe you might have to wait, but usually if you get there right at 6 a.m., you're going to be seen pretty quickly. There is a referral form that I can provide to you, Nicole, if you're interested. It just kind of expedites the process. If it's too much, that's okay too. I only offer it as an option if folks really do want to do an appointment. The patient will meet with our intake counselor after they check in at the front desk, and they're going to run cures just to see if they have any outstanding prescriptions for opioids and fill out some intake paperwork. This is a portion where we'll go over release of information. So if there's anybody you want us to talk to about your time here with us, this would be an opportunity to fill that out. You can do it anytime with your counselor, but we will ask, right away, right then, like if you have a doctor, if you want your mom to know, or if you have a probation officer, things like that. You'll meet with our doctor to perform a physical exam, assess drug history, withdrawal. As this part's important, our doctor is going to try to do an initial dose based on how severe the withdrawals are. So if a patient comes in and they are currently under the influence, they're feeling the effects heavily, then we can't provide treatment. So the patient does have to be in some level of withdrawal so that our provider can properly assess the milligram that the patient will need, because each dose is unique to each patient. We don't have a standard like, oh, everyone starts at 30 milligrams. It is based on that patient's drug history, their physical needs, and how bad their withdrawals are. So it's a very complicated question, complex question, I should say, between the patient and their medical provider. The doctor prescribes this patient. I'm sorry, he prescribes the medication to the patient, and then they are seen immediately for dosing. So they go to our dosing window, they meet with our dosing nurses, they receive the medication, and then the very first time we request that they wait for 30 minutes. The reason why is we don't want any adverse reactions. And then once that's done, then we don't make them wait any longer after that. It's just the initial dose. So right now we have the no cost treatment grant, also known as the State Opioid Response Grant. This was provided by the Substance Abuse and Mental Health Services Administration. This was meant to aid individuals who want treatment but are facing financial barriers due to no insurance, in between insurance, people who cannot use their insurance. Some examples of folks who can't use their insurance might be they can't pay the patient responsibilities, so they have high copays. They're just released from jail, or their work insurance, they don't want to use it. They're afraid of losing their privacy and confidentiality. In that situation, we can use the grant to cover it for them. So this is a really great opportunity. If anybody's willing to accept treatment, we can figure it out for them. Money shouldn't be an issue. And then that concludes my presentation. I am open to any questions or concerns that anybody has. I know that was a lot. I feel like I was kind of all over the place. So by all means, let me know.
No, thank you so much, Danielle. That was really good. Can we take our shared screen?
Oh yeah, I'm sorry about that. I'm all hogging everything over here.
Well, it looks like Mariah's jumping in and out. She's having some internet, some Wi-Fi issues. But thank you so much. That was amazing. I know you do have a hard stop at 5:45, so there was a lot of questions that you already answered for me when I went to take the tour at the program last week. So, you know, and I definitely can put in the description about some of the things that, you know, I learned. But Lacey is for sure, that's her part right there. She does harm reduction. That's what her organization does.
Okay.
And I think I talked to you about her. Lacey, is there anything you want to discuss or have any questions for Danielle?
Yeah, thank you for that presentation, and I appreciate you coming on to the meeting today. I have a couple questions. Where currently are the clinics available? Like what cities?
So we have quite a few, and I'm probably going to forget some. We have here Antioch, and then I think the next closest to us would be Richmond. We have a few in Sacramento. We have one in Stockton. We have one in Vallejo. We have two in San Francisco, and we have, I believe, I want to say two in Oakland. It could be wrong, but I know for sure we have at least one clinic in Oakland. And then there are more, but that would be, I think, it for the Bay Area and in Sacramento.
Sorry about that. Yeah, thank you. And in those cities, do you guys have partnerships with like other harm reduction services like HEPAC or similar organizations?
I'm not too familiar with HEPAC, and I'm just speaking for the Antioch clinic only. My cohorts may have other connections that I'm not aware of. The few that I know for harm reduction out here in Antioch, I'm trying to think. I know we're working with some other methadone clinics in like outside of Antioch. A new one just recently opened in Walnut Creek that we're working with to try and help support them. I'm on the Alcohol and Drug Advisory Board and their harm reduction and transitions meetings. But other than that, I'm here in Antioch. I don't think there are quite a few that I'm aware of anyways, and I'm open to hearing about them.
Yeah, for sure. I'd be interested to know if like the clinics in Oakland specifically partner up with HEPAC. They're the HIV Education Prevention Project of Alameda County.
Oh, yeah. We do out here in Antioch. I had made a presentation to the STD and HIV health board out here for Contra Costa County. So we're working with them. They're aware of us. We have they're we have a fairly large contract with them, so they're aware of the services we do, but I recently did a presentation with them. Oakland, I would hope so. I know that they did not receive the grant, so not all of our locations are able to provide free treatments, so they might not be spending as much time and resources trying to reach out to the community, but I would be shocked to find that they didn't know about any of those kind of programs out there.
Okay, yeah, I was just curious because especially in Antioch, they do one syringe exchange per week out here in Antioch, and then
Oh, I didn't know that.
yeah, and then they were also, for a while, we were contracted with them, and so while we were distributing the Narcan, we were contracted with them receiving the kits through them. So I thought that, a clinic and a harm reduction program or service in the same community would benefit from just kind of having a relationship, especially because out in the field, when people are wanting to take the step to try to, go down the path to getting off of certain substances, a lot of times the people providing them harm reduction services in the field are the first people that they're going to talk to. So having a personal relationship with someone at the clinic might be helpful.
Yeah, I'm sorry, you said it was HVAC?
So it's HEPAC. It's HEPPAC.
Yeah, no, I would like to reach out to them and try to connect, because especially if they're available to give kits, like overdose kits. Is that what you mean? Like to try and prevent overdose?
Yeah, so we were contracted with them for a while, and we were able to get 30 kits per month, and each kit has 2 injectable and 1 nasal Narcan, naloxone, and then just some like informational pamphlets about teaching people how to recognize an opioid overdose, things like that.
That's awesome. Yeah, that would be good for some of our patients, I think. So I would like to try and reach out to them. I don't know if you have a direct contact that I can try and do that. If so, maybe I can share my email with you, or maybe Nicole might be able to do that.
Yeah, for sure. We can do that offline. I don't want to keep you over, but does anyone else have any questions?
Just really quickly, because I thought that it was really important when we discussed the Medi-cal. So, because a concern of mine was just having folks that may be like just way on the other side of the city, getting to the BAART program, the clinic, and can you just go in just a little bit about like how does that work with the Medi-cal?
Yeah, so I can provide you with additional information about the whole process of how it works. But if you are a Medi-cal patient, you are entitled to a rideshare program for MAT services. So this is great for patients that might not be able to afford MAT, and they might be like, let's say, live in Concord, because there's some clinics out there, but they can't afford it. Then they can come to the Antioch clinic and get it for free. And the Medi-cal rideshare program will provide free transportation for MAT services. So that's not just picking up the medications, also for counseling and other treatment. It does take a while to set up. I believe it takes about 2 weeks, I want to say. But there's a phone number that you can call, which I think I provided to you already.
I can actually put that in the link of the.
Oh, okay. I was like, I'm gonna look it up real quick.
Yeah, I can put that in the description link, in the description too. And I also just wanted to, because I don't know if you watch us, but we have been we are pretty critical of the community engagement team. So when talking to you at the clinic, I was, just really surprised how you said that, they have kind of stepped up, because there are concerns in the community about, the area. It's very controversial about, just the clinic in general and the traffic in that area. So if you could just go into a little bit, she was saying that they have been amazing and as far as helping the clinic and the folks that are in that area. Is there anything else you want to give kudos to them?
Well, the only functions that I've worked with them is directly with our clinic. So So far, what I've appreciated about them when they came and spoke to us, because I reached out to them, I asked them to come to our clinic and meet with my director and with our staff, because there was some miscommunication between us and local Antioch PD in general. It got to a point where there were situations that were happening that were dangerous, that were involving children in our patients, and the police weren't coming. So we were getting, I got pissed about it, because if I have a child in danger, I need the police to show up. So I wanted to know what the hell's going on here. So when we reached out, they apparently, I guess this was prior to when I came, our clinic director, not our current one that was prior, advised that they weren't allowed on our property whatsoever, ever, for any reason. So when we were calling them, they were parking on the side of the road. I can't remember the name of that street. Davidson, I think.
Davidson. Mhm.
Yeah, they park over there, like where the bus stop is, and we're like, where the hell are they? Because we told them they weren't allowed on our property because it's private and blah blah blah. So in order to alleviate that, I was like, we need to kind of extend an olive branch. And when they came, they they agreed. They introduced me to the set team, and they promised us that they would respond to phone calls, and they would not resort to arrests or like seizing of property as a first resort. And so far, they have kept their end of the bargain. We've had situations where patients have felt like they can't come to get their treatment because their old drug dealers are hanging outside of our clinic. We call the set team, they come, they just literally park in our parking lot, and those drugs, they scatter, they just leave because it's too dangerous for them to be there anymore, which I think is great. And some of the domestic violence situations we have also dissipated because of just them sitting in the parking lot, which I appreciate that they have, that's all they're doing. We've had some situations that occurred that don't really involve our patients. They're just folks that kind of, as my director calls it, come to the candy store, I guess. That was a little more aggressive. There were folks that are in active addiction and refusing to leave, started swearing, started attacking the officer, and they didn't arrest them, but they held them and then let them go. And so I thought, given that circumstance, they didn't even arrest them and they didn't seize their property, even though the truck was.
They couldn't.
Yeah, I mean, they could have. They legally was in their right to do it, but they didn't. So I don't know if they're trying to improve their image as well, but so far they've been a huge help to our patients feeling safe. And it's helping in the neighboring communities. So like the neighboring businesses, they're feeling more comfortable. Yeah. And it's just improved overall the operations of our clinic. So hopefully it continues. I've heard that they have a little bit of a bad reputation, but so far they've been doing wonderful working with us.
Great. Well, that was really, I was surprised at that, but that was really great to hear. Yeah, that was really great to hear. So I know we're at that 5:45 mark. I just want to say thank you so much. And I definitely will put your information, out there. Thank you. And it, like you said, if, we all have our own different organizations that have do different outreach, and it feels really good to be able to have someone that we can, call or get information from if we do come across someone who is in need of your services. So thank you so much, Danielle.
Yes, and please do connect me with Lacey. That way we can try and I can learn a little bit more about the HEPAC, HPPAC. I'm pronouncing it wrong already.
I think it's HIPAA, ain't it, Lacey?
HEPAC. I don't know.
HEPAC, yeah.
Okay, well, we definitely will do that. Thank you so much. And I think we're done, Lacey. This meeting was just simply about letting the community know a little bit more about the BAART program. And you all have a really, really beautiful night.
Yeah, you too.
Thank you.
All right, have a good night.
Bye.